name is Brad Bates, and I'm going to talk about student athletes and preventing addiction. Some of the addictive behaviors that are affecting our student athletes these days are things such as alcohol addiction, substance abuse addiction with things like cocaine, heroin, or marijuana, prescription drug addiction, things like painkillers that team doctors are prescribing injured student athletes in order for them to get back into training or get back into the starting lineup a little bit quicker. And lastly, things like eating disorders. Many times, percentage-wise, female student athletes are mainly affected with eating disorders, but male student athletes are also have an issue with this disorder in sports such as wrestling, diving, and gymnastics. Many times, students that are not athletes look to relieve stress by going and working out or running a couple miles or playing a pickup game of basketball. But for our student athletes, to find a way to relieve stress, many times they will turn to an addictive behavior. Going out and playing a pickup game of basketball or running or doing a workout is part of their daily job in being a student athlete anyway. So any way that we can provide our student athletes with a creative and positive way to relieve stress can go a long way to preventing addictive behavior. The next way to help prevent addictive behavior is to make sure the athletic department is hiring coaches that will put forth the right message about these issues. These coaches spend every day with these student athletes at workouts, at practice, traveling, and at competitions. And then many times these student athletes see these coaches as mentors and look to them for guidance. If our coaches can put forth the right message about these issues, we can hopefully prevent an addictive behavior from happening. Coaches also need to keep an open line of communication with the athletic department and academic advisors as well to make sure none of the student athletes are slipping through the cracks. Also, universities can take the advice of the University of Louisville and team up with a local hospital. The University of Louisville has borrowed 2 specialists from a local hospital and use them within their athletic department. They've brought on a psychiatrist and a dietitian to meet with each student athlete twice a year to make sure that the student athletes are leading a healthy lifestyle and that there are no addictive behaviors developing within these student athletes. Each freshman at the University of Louisville is required, that is a freshman student athlete, is required to take a 3-credit-hour course that demonstrates how to lead a healthy lifestyle. This course can go a long way in being a preemptive strike to help prevent the addictive behaviors from forming. And lastly, as academic advisors, it's our responsibility to develop these student athletes as a whole, not just concentrate on their academics. We need to work with them on developing a sense of self-pride and self-worth off the field as well as on the field. Demonstrating to them that they can succeed and have success off the field can go a long way in preventing